Hello, I am Dr. Tina Meder, and I am very happy to present to Myo community the presentation about toxin-free wrinkles correction. We created this protocol with our best-selling Meder Myofix treatment, which we launched 15 years ago on the market, and it's still revolutionary, it's still innovative, in a combination with Myolift microcurrent therapy, which I consider as the very best in the world. Meder skincare therapists from Norway till United States of America, everywhere they're using Myolift devices with our Myofix toxin-free wrinkles correction. So let me share the presentation with you. And now, hope everyone can see it. And I will be speaking about protocols and best practice of the wrinkles correction. So let me start from the history of wrinkles treatment. Obviously, people try to eliminate and diminish visual wrinkles appearance from the very beginning of the known world of humanity. Actually, very first mention of the wrinkles treatment, they've been found even before our time. So it's like 30 years before Christ, the first mention of the wrinkles treatment. People used natural preparations of oils, plants, minerals, whatever. They used some really exotic and eclectic substances, concoction, even some animal and human placenta. But until 20th century, there's been no progress in this area. So it helped somehow to diminish wrinkles, especially when they used some moisturizing substances, but it was impossible to eliminate wrinkles completely. Some of eclectic treatment appeared on the 19th century. I always mention this phony wrinkles patch because it's still on the market. It is amazing, isn't it? It's just patch, mechanically fixing wrinkles, but it's still in the market, especially in the United States. But in the mid of 19th century, the first relatively modern treatment appeared based on the proteins called albumin. We don't use it now. It is animal sources, but it's really tightens the skin and diminish visibly wrinkles. But the next one, the real revolution, happened in 1985 when retinol-based solution appeared on the market. Retinol renews the skin so fast then you can really diminish wrinkles appearance in a few weeks. Yes, it comes with some side effects. Irritation, skin redness. It's very uncomfortable for sensitive skin. It's uncomfortable for dry skin, for mature skin, but it works. And next revolution happened in 2001, when the first botulinum toxin injections have been registered and renowned by FDA. Botox was used in the neurology and ophthalmology previously, but Dr. Carruthers noticed that patients after Botox injections have less of wrinkles. In a few days, wrinkles magically disappear. So it was offered as a wrinkles treatment, but also with some side effects and consequences. And in 2009, we in Meder Skincare, created by me, Dr. Tina Meder, we launched our first peptide-based Myofix wrinkles treatment in France. Since that, in 15 years, we are operating in more than 30 countries over the world, and it is still our best-selling treatment. We are focusing on mimic wrinkles here. Also, they can be called dynamic wrinkles or expression lines because it really follows the facial expression. When you experience some emotions, it's always reflect in our facial muscles. Why? Because human beings communicate via facial expressions. That's not only verbal. Actually, about 70% of our communication is nonverbal. That's why it's so difficult to speak phone when you're starting to speak new language. All foreigners know about it. And that's how we understand each other without knowing the language. Sometimes you have an impression, yes, you know what about this person is speaking, despite you don't understand real words, because we have our facial expression. And when we experience emotion, when we try to show some emotions, our muscles works. But if it works repetitively, if you have the same movement of facial muscles in the same zone of your face, for example, you're constantly worried, you are always trying to think about something unpleasant, you have the so-called 11 lines in glabella area, and very probably you will have crow fits as well because the muscles are synergetic. So these lines and wrinkles, they are caused by repetitive movement of facial muscles. And actually, they're not directly related to the intrinsic aging. You can develop expression lines, mimic wrinkles in the very young age if you experience some emotion. It will not happen at 16, but it can happen to people 25, 27 years old quite easily. All you need is a persistent emotion. All expression lines are located in the upper and mid face. It's never in the low face because we don't have mimic muscles here. The difference between facial mimic muscles and all our body muscles is that facial muscles are entwined to the skin. In the body muscles, all muscles are fixed on bones. So when you move muscles, your bones move. And in the lower part of the face, we have muscles which are moving our bones, mandibular and everything. But in the upper and mid part of the face, muscles are entwined to the skin, so it literally the bones, and the skin moves, not the bone. And this movement of the skin create folds, wrinkles, and lines. And it will progress naturally from superficial to deep lines, unavoidably, if you do nothing about it. Natural loss of collagen will help wrinkles to develop. If it starts in 25, very probably it will be quite deep when you're 35, 40. If it starts later, it will be much more superficial. So that's the whole reason to prevent it. And it will transform to lines and folds following skin aging process. At some point, it became age-related. But when it starts, it's not intrinsic. It's not chronological aging. It's mostly external. Just a few words about anatomy. As I told you, the facial muscles which create mimic wrinkles, you can see on the picture. That's the forehead frontalis muscles. They are muscles of glabella, which called procerus. They will be orbicularis oculi muscles, muscles around eyes, all muscles of the nose, zygomatic muscles forming the cheeks, but masseter muscles, which help us to eat, it is already not mimic. It is real skeletal muscle, so without no entwinement into the skin. And you can see on this fabulous picture how muscles create the face expression. It's never alone, so when one muscle moves, it is always a synergy with another muscles working, helping this muscle and reinforcing this muscle in the same time. And also that will be some opposite muscles, which will be relaxed at the same time to create face balance. So when your forehead is very tensed, synergy will be with orbicularis oculi muscle, so you will develop crow fits, wrinkles. And it will be some work from the zygomatic part. So it will create the marionette line if this emotion is persisting and your forehead is constantly tensed. But this part of the muscles will be relaxed because it works as an opposite. It's antagonistic. And the back of your neck will be tense too. So finally, after 10 years, of wearing and get your forehead tense, you will be with a little bit shortened neck, very tensed shoulders, and jawline, which is deformed. So when we work with the face, you should think not only about the face, but about the whole situation. When you relax neck, it will relax forehead, and it will tonify and improve the jawline. So think about it, working with your passion. Biochemistry of neuromuscular contraction, it's quite complicated. I will not stay on each step, but what you need to know and what you need to keep in mind when you are treating, when you work as a skin therapist and work with expression lines, that's a few important steps of the biochemical contraction, which explains the whole movement. First of all contraction is born in the nerves, in the nerves fibers. It is born in the nerves, not in the muscles. To make muscle contract, we need the impulse coming from the nervous system. And this impulse is electrochemicals. It is electro, so spoiler alert, when we use microcurrent therapy, it helps us to slow down this electric impulse. But to get the full results, we need the biochemical action. We need peptides to interact with this chemical part of the electrochemical impulse. So muscle contract when neurotransmitter called acetylcholine released by neurons. You can see the number 1, it's where it happens. All neurotransmitters just start a whole cascade, the waterfall of different biochemical interaction. And finally, the small vesicles containing a lot of neurotransmitters will fuse it into the muscles, into the space between nerves and muscles membranes. When it is in this space, which called, when they enter this space called presynaptic terminal, acetylcholine join another part of the neuron, release acetylcholine out, and it's mediated by the specific protein called SNAP. It is important because it's how we stop the process to happen. We use substances which are similar to this protein. So the final complex called SNARE cannot form properly. If this complex is not formed, cascade doesn't happen. Acetylcholine doesn't fuse out of nerves, and muscles is not contracted because it doesn't get this chemical impulse. How botulinum toxin works? What was the revolution? Botulinum toxin, it is a poisoning of the nerves and muscles. So when this acetylcholine is ready to release, the botulinum toxin destroys completely this important SNAP protein, so SNARE complex cannot form for another 4 months. And it is very long time, so your muscles are paralyzed for 4 months. When injected locally, in the theory, it should work only with these muscles. Sometimes it works more globally, unfortunately, what causes side effects like ptosis, closed eyes, low brow position, asymmetry of the face. Sometimes it even can interact with immune system of the body, causing some influenza-like symptoms, which is really seen as a side effects of the botulinum toxin injectables. And it's really unwanted side effects. So botulinum toxin, it's really toxic paralysis of facial muscles. Why I never used Botox in my practice and why I don't use it? First of all, even when it was started in the beginning of 2000s, I'm not ashamed to say that I was in the industry at these days. I run my clinic in France. But I been trained for Botox. I was very curious about this, as any dermatologist should be. And when I was in the training, I asked questions, and I wasn't satisfied with answers, because I have education including cardiology. My first specialization was cardiology. And I was very curious about the immune reaction of the body, because I knew about botulinum toxin and intoxication caused by the toxin. It is a really severe illness. But I wasn't satisfied with an answer. So when trainer told me, then actually it's different kind of botulinum toxin, it's very safe, it cannot be safe. It is the same toxin. It's one of the most toxic substances in the whole world. So I didn't start to use it. And now that's new information coming from the science and published in the scientific journals. And it's just proof what we thought about it for a long time and discussed it internally. Actually, when Botox paralyzes muscle movement, it disrupts the modulation of activity between the face and the brain. It happens. It's scientifically proven now. And this activity between the face, the amygdala, and the fusiform gyrus create side effects as an impairment of empathy. Yes, it's not rumor. When you're injected by Botox, you feel less empathy to other people. It affects learning ability, which is important too. And it affects awareness of change in emotion, so facial feedback. Literally, if you get the Botox injection for the upcoming 4 months, you understand less what is going on around you. You are less able to predict people's behavior. Also, there are well-known side effects of Botox, like different kind of ptosis, asymmetry of the face. And what is important for me as a medical doctor, that up to 15% of patients injected serially, when they get more than 8 injections during the 4 years by statistic, up to 15% of them develop secondary non-responsiveness to the botulinum toxin, because the body starts to naturally produce antibody. It works like a vaccination. And one day, you may need it for the real treatment, for the real neurology illness or ophthalmology illness. We don't want it to happen, but if you need it, it's better to not get antibody in your body. So that's why I don't use Botox in my practice, and why I developed the toxin-free wrinkles treatment. It was developed with neuromuscular peptides in 2009. I am very proud that we've been one of the very first brands on the market offering professional anti-wrinkles treatment. In the 2 years, in 2011, we've been officially named as an alternative to Botox treatment to patients with contraindication by British Association of the Plastic Surgery. And it is safe, because peptides, they don't interact with the body systemically. It stays where it was when you applied it, and it just destroyed naturally by the body. So it not paralyzed muscles, but it paralyzed only the superficial part of the muscles entwined into the skin. And we use a lot of prebiotics and probiotics here, so it is microbiome friendly, easy to perform. And after 5 treatments, you get long-lasting results. You will be wrinkle-free, or at least it will be very visibly diminished for upcoming 6 months or more, if you're a little bit more lucky, especially when you combine this treatment with Myolift microcurrent therapy. Because remember, neuromuscular contraction is electrochemical. So you need microcurrent for electro part and Myofix for chemical part. What we use here? We use 3 amazing, awesome, innovative peptides, which acts similarly to botulinum toxin, but without toxins. It's safer, and it stays where it was. Peptides are obtained with a method developed by the Professor Bruce Merrifield, and he got Nobel Prize for it in 1984, Medicine Nobel Prize. And arginine, the first peptide, which we use in the 10% concentration, it's partially damage this FNARE complex, inhibiting release of acetylcholine for 33%. So your muscles are already contracting in a third less after the application of this product. But the beauty of these peptides is also it's upregulating pro-collagen synthesis genes. So epigenetically, it boosts the collagen synthesis in your skin. And as it does epigenetically, it is not for one day. It is for months to come. You really prevent this loss of elasticity and you feel wrinkles from inside. And it is non-toxic, scientifically proven to be non-toxic, safe to use in topical application for all category of people. Second peptide we use here called SYN-AIC, and it is even more known than arginine. SYN-AIC is mimicking protein of Indian temple vipers toxin, and it inhibits another receptors. If arginine works with nerve fibers, SYN-AIC works with muscles. So this acetylcholine released from neuron, you remember, it's not a Botox, so it's not a fully paralyzed muscles. We just reduced the releasing of acetylcholine by a third. When it's released, muscle is much less responsive because SYN-AIC block muscle's ability to interact with acetylcholine. And once again, no systemic action. And finally, third peptide called lufusil, we use it to increase the efficiency of the arginine. So it increases the efficiency by 48%, by half. So when you combine arginine with lufusil, you have this kind of amplified action of peptides. So your nerve fibers release like about 40% of acetylcholine. Your muscles meet this acetylcholine with less responsiveness. So we get about 20% of muscle contraction comparing with non-treated muscles. And this 20%, it is not strong enough to move your skin. You still can do it, like me. Yeah, I can raise my eyebrows, but I do it consciously. I can show that I'm unhappy, but I do it consciously. I don't have any spontaneous mimic. I use Myolift, obviously, for the last 15 years. Once a year, 5 weeks, after I am just free, wrinkles-free for upcoming 11 months. And last peptide we use here, it's called matrixyl 3000. It is a matrixin peptide, and it is not neuromuscular. It doesn't interact with a muscle contraction. It reconstructs the skin. It fills the wrinkles inside because we should boost collagen synthesis to fill wrinkles. So we have this double side action. We partially paralyze muscles. We slow down muscle contraction. Our skin became intact. When you express your emotions, your skin doesn't move or moves much less. And at the same time, you improve elasticity of the skin. So it is prevention of wrinkles formation. Key benefits of using Myolift microcurrent therapy in combination with our toxin-free Myofix treatment, it is this electro part. It mimics the same signal that brain sends to the muscles. So when you use this erase mode, it relaxes muscles efficiently. It synchronizes the body bioelectrical energy on the cells level. And it helps us to push peptides even deeper in the skin so we can get even more results, simultaneously increasing the energy level in cells, so rejuvenating cells. So we use all 3 regimens, as you will see in the demo, to perform the treatment, and we have really great results with our awarded Myofix treatment. Few words about the severity scales of wrinkles. Obviously, when you have superficial wrinkles, you need less of efforts. When you have deep wrinkles developed like 20 years before, very probably you should perform more treatments and you should offer some supporting home care solutions as well. We have 4 stages of wrinkles, starting with 0, complete absence of mimic wrinkles. In stage 0, we speak only about prevention, not about the treatment. And finally, to stage 4, when deep folds appear both on the moment of tension and relaxed states, when the skin remains unchanged. When you have a stage 4 wrinkles, there are age-related changes as well. So when you paralyze skin, you cannot eliminate the wrinkles completely because your skin is already changed by age. So we need more efforts, and probably after working with expression lines, we go to another step, offering some anti-age treatment, reinforcing the skin structure, the skin architecture. Our recommendations, and at stage 0, you can start with really one Myofix Myolift treatment in your clinic and your salon, and follow by applying Myofix home care concentrate once a day for upcoming 5 weeks. It will be enough for prevention for the upcoming year. In the stage 1, you offer the full course of treatment, 5 treatments once a week for 5 weeks time to get maximum results. In the stage 2, when wrinkles are deeper, you offer the same course of treatment, but combined with a home care to maximize results and to ensure long-lasting results. And finally, when the skin is already mature, when you observe age-related changes, you offer this full course of treatment, coming until 10 treatments if you feel like you need it. Combined with a home care treatment, we have special Myofix concentrate home care version to apply on the expression lines daily, and we have special face calming mask based on the SYN-AIC peptide with matrixyl, which can be used between the treatment once a week. And obviously, you perform the treatment once a week combined with microcurrent therapy. How it works, you can see results here. It's not only about expression lines, it's about skin health. It's about the skin strength and tightness. It is a safe, efficient alternative to injections, to some invasive treatment, but in the same time, it enforces skin. It improves the skin quality because we offer here not only one treatment. Sorry, just one sec. I will try to just to finish the presentation. Not only one treatment not only one product based on peptides, but the whole combination of 6 products with a whole protocol of skin stimulation, including unique 3-step protocol of preparation with niacin-amide, which enhances peptide penetration and helps to achieve the maximum results from the microcurrent therapy. We use here biophysical stimulation by microcurrent therapy to facial muscles, amplifying all effect of myorelaxing peptides, and we moisturize the skin deeply, globally, restoring the healthy skin barrier and the healthy skin microbiome. Here you can see before and after with only 1 hour difference. And this client, she is in her 50s and her skin is very sun damaged. We get this result from Australian beauty salon Mia Bella. And you see, you can really transform the skin in 1 hour. Imagine what you can get after 5 weeks of treatment with microcurrent therapy and proper home care, medical grade of home care like we offer in Midder. What you need to know about the treatment? Who needs it? It's ideal for anyone concerned about appearance of wrinkles, especially upper part and mid part of the face. There are no age limits for this treatment. It can be used by individuals of all ages. It is good for all skin types and all skin tones. There are no contraindications to the treatment except for some known allergic reaction. So you can base your choice only on the contraindication for microcurrent therapy. The duration of the treatment is about 60 minutes. And once again, we recommend to perform the full course of treatment for all stages of wrinkles, starting from stage 1. Only for stage 0, I recommend to get one treatment. That will be enough. For the rest, please perform the full course of treatment. And here products. Pharmaceutical packaging, highly dosed, sterile, all you need, open and apply on the skin like you will see in the demo. We prepared for you the full protocol, the full learning video, and you can start to work with this product in the combination with Myolift microcurrent therapy tomorrow if you want it. You can order it from 7 Wellness site from the mid-September or from us, Midder Beauty sites, and both team will be happy to help. So please enjoy Midder Myolift Wrinkles Correction demo. And when you see the demo, you will notice that we perform the whole Myolift microcurrent therapy treatment on the top of our sheet mask. This mask is imbibed with the generous ounce of conductive active gel. It gel contains peptides and conductive liquids such as hyaluronic acid and ionized ions for create more conductivity. If you want to perform it longer, like for 30 minutes, don't worry, it will be largely enough. We did it thousands of times. It always works on the top of the mask, so you don't need to add any gel to the treatment. All you need will come to you for the MyFix box, ready to use. So please enjoy the demo.
Step 1. Apply Energy Net Cleansing Mask. Massage gently until partial absorption. Don't be alarmed if skin appears slightly reddened afterward. This natural reaction is a desirable effect of niacinamide, which boosts healthy blood circulation. Before the end of the treatment, the redness will subside. Use wet sponges to wash off. Gentle micellar emulsion effectively cleanses, while preserving the skin's natural lipid barrier, activating microcirculation, delivering oxygen, and energizing skin cells, enriched with probiotics and niacinamide for healthy skin renewal. Step 2. Apply Enzipeel Exfoliating Mask. Massage gently for 5 to 6 minutes, focusing on wrinkle areas. Double Action Exfoliating Mask combines gentle probiotic exfoliation with micronized opal particles for skin renewal, selectively targets dead skin cells, minimizing irritation, suitable for sensitive skin types. Use wet sponges to wash off. Step 3. Apply Energy Soin Antioxidant Serum. Lightweight serum enriched with plants, antioxidant complex, and niacinamide designed to energize, brighten, and improve skin permeability for maximum treatment effects. Massage gently until fully absorbed. Step 4. Apply Myofix concentrate. It contains the highest concentration of 4 innovative peptides. Myofix targets skin's interaction with facial muscles, reducing reactivity to muscle contraction and relaxing facial muscles. Use cotton stick to massage into lines or wrinkles on forehead, glabella, eyes, and lips until absorbed. Step 5. Apply Myofix mask. Unfold the mask and apply it thoroughly to the face and neck. Secure the side openings over ears. Pull the mask down to cover the chin and secure the other pair of loops over ears as well. Step 6. Myolift microcurrent therapy. 1 probe set close to the ear. Second probe is gliding from the center line of the face to the first probe, following massage lines. Stop when the probe applicators are close but not touching. Repeat the same movement 3 times across the jawline, cheek, and the forehead. One probe set close to the ear, second probe gliding down from the temple to the ear. Stop when the probe applicators are close but not touching. Place a wet sponge on the clavicle. Spread the mask gel over the neck. Place 1 probe on top of the sponge. Slide the second probe from the ear towards the first probe, but not touching. Repeat on another side of the face. Place first probe on the clavicle, on top of the wet sponge. Second probe is placed or slides on top of the mask. Glabella 11 lines. Place the probe in the middle of the forehead. Hold for 2 minutes. Forehead. Glide on top of the forehead, up and down. Direction. Glide up slowly with a little pressure. Slide down slowly without pressure. Start from the center and move the probe to the right. Repeat movement 3 to 4 times until you reach the temple area. Repeat from the center of the forehead, moving to the left 3 to 4 times. Crow's feet. Slide the probe from the temple area down to under eye area, then glide back up to the temple area. Repeat 2 to 3 times for each side. Upper or lower lip. Place the probe above upper lip and hold for 1 minute. Glide from the chin up to lower lip, closer to the end of the mouth. Repeat this movement 4 to 6 times. Cheek. Slowly glide the probe from the center of the face to the ear, back and forth, moving up each line until you reach the eye. Repeat the same movement on another side. Glabella 11 lines. Place the probe on the middle of the forehead on eyebrow level for 1 minute. First probe set up at the clavicle, on top of the wet sponge. Second probe placed, or slide on top of the mask. Jawline or platysma. Place the second, moving probe under the jawline, under the chin, and slide up to probe. Then hold for 3 to 5 seconds. Perform this movement from the center to the jawline. Repeat 2 to 3 times. Jawline or marionette lines. Place the moving probe above the jawline, under the corner of the mouth with little pressure. Lift up the probe, starching the muscle, and hold for 3 to 5 seconds. Move to the ear with the same motion. Repeat 2 to 3 times. Place the moving probe above the top of the lip and use little pressure to lift up, starching the muscle. Continue towards the ear. Repeat 2 to 3 times. Work on risorius muscle. With a little pressure, push the moving probe applicator from the side of the mouth towards the earlobe and hold for 3 to 5 seconds. Repeat twice. Zygomaticus major. Place the moving probe by the side of the mouth, pushing upward motion towards the middle of the ear. Stop when you have the cheek muscle lift and hold for 3 to 5 seconds. Repeat twice. Place the moving probe by the side of the mouth, pushing upward motion towards the temple and hold for 3 to 5 seconds. Repeat twice. Under eye area. Place the moving probe under the eye, next to the nose side. Slowly and gently move to the temple. Repeat twice. Eyebrow lift. Place the moving probe under the eyebrow. Make sure that mask is covering the area. Eyebrow lift firmly so the brow is arched. Holding for 3 to 5 seconds. Move from the center to the corner of the eyebrow. Repeat twice. Forehead. Place the moving probe above the eyebrow with a straight pressure. Slide up to hairline and hold for 3 to 5 seconds. Move from the center towards the temple. Repeat twice. Repeat same movements on the other side. Step 7. Apply Dermafill Prebiotic Moisturizer. Massage gently until absorbed. Prebiotic Moisturizer Dermafill nourishes and hydrates the skin after treatment, protecting it from air pollution and environmental damage. Step 8. Apply sunscreen if treatment is done during the day.